My name is Dr. Mackenzie Haynes with Blue Oasis Pet Hospital, and I'm here today to talk to you guys about cat eye care and cat eye care problems. I've got my assistant Courtney here to ask me some questions.
What are some signs of conjunctivitis in cats?
Conjunctivitis in cats, or an eye infection, can manifest as a few symptoms. So mostly we think about redness of the eye, swelling of the conjunctiva, or the pink fleshy portion of the eye, discharge in the eye, squinting, and sensitivity to light.
What are the symptoms of a scratched cornea in cats?
A scratched cornea, or a corneal ulcer in cats, can have a lot of similar symptoms to conjunctivitis. So you may see excess redness of the eye, swelling of the eye, discharge, really a lot of squinting due to pain, or blepharospasms is what we call it, and they can be also very sensitive to light as well.
What are cataracts in cats, and can they be treated?
Cataracts in cats is an increased opacity, or kind of increased density in the lens of the eye. This can cause vision troubles in cats, and it can be treated. So typically we recommend referral to one of our wonderful veterinary ophthalmologists for surgical consultation for cataracts, but these can be treated in cats.
What is feline glaucoma, and what are its symptoms?
Feline glaucoma is a buildup of pressure in the eye, typically due to a loss of aqueous outflow in the eye. So the eye is unable to drain the aqueous humor properly. This results in a very high pressure in the eye, which can manifest as increased globe size, so like bulging of the eye. For very chronic cases, you can see a lot of redness, discharge, discomfort, squinting, and this is something we diagnose by checking the eye pressure or tonometry.
What are the treatments for feline eye ulcers?
For feline eye ulcers, it is a very multimodal approach to treatment. So we will typically combine one or more topical antibiotics for the eye. These ulcers, even if not caused by an infection, do become infected after some time. So we want to help prevent or treat any infection that is present. We will administer a hyaluronic acid topical to the eye to help the corneal ulcer, that layer of epithelium, kind of help heal itself. And we will often prescribe oral antibiotics and potentially pain medications as well, as this is very painful. If the ulcer is not healing with medical management, we will often recommend debridement of that abnormal corneal epithelium so that the eye can heal properly.
What should I do if my cat's eye is cloudy or has discharge?
Cloudiness or eye discharge can be signs of a more serious problem. So we would recommend having your cat examined by your veterinarian and potentially having some diagnostics performed to see what might be going on. Thank you for being with me today to talk about cat eye care. If you guys have any further questions, or if you feel like your cat is experiencing an eye problem, please don't hesitate to call us.